Right, good evening, everybody. It's my privilege tonight to introduce a speaker to you. I think we're in for a great surprise because Annette is a very highly qualified physicist. She knows what she's talking about, and she always has great information to share. So over to you, Annette.
Okay, thank you, Barbara. So Barbara says I'm a physicist. I trained as a radiotherapy physicist, worked in the NHS until a few years ago, and I currently work for a medical devices company. However, that has not meant that I've lost my interest in health and the role that nutrition plays with it. So Barbara asked me to talk about multiple sclerosis. So has that moved along? Yeah. So multiple sclerosis is something that is part of a group of conditions called autoimmune diseases. So I would just like to give some background about the immune system and immunity. Now, I'm going to start with a baby. So a newborn baby's digestive tract is sterile. So it means that there's nothing in there. Now, as the baby drinks breast milk, its digestive tract is colonized by bacteria that they get in with the breast milk. And then as the child grows, more bacteria species colonize the GI tract, and those bacteria species extract the nutrients and energy from food. They protect against pathogens, and they contribute to a normal immune function. Now, a healthy immune function defends the body against invaders like toxins, infections, and allergens. And the way it does is by developing antigens to help it recognize an invader and to then mobilize the immune system whenever it meets that invader again. Now, autoimmune disorders occur when the body's immune system attacks and destroys healthy body tissues by mistake. So, and this may be because at that point, the body is fighting something like an infection, a toxin, an allergen, a food even, or perhaps stress. At that point, the immune system can't distinguish between healthy tissue and antigens, and somehow it redirects its attack to the body, tissues in the body. And in the case of multiple sclerosis, it attacks the nerves. Now, the exact cause of these autoimmune disorders is unknown. One theory is that drugs or microorganisms like bacteria may trigger the changes which confuse the immune system. And unfortunately, research has found that if you have one autoimmune disease, you are at a higher risk for developing others. Now, autoimmune disorders may result in an abnormal growth of an organ, changes in organ function, or in the case of multiple sclerosis, destruction of body tissues. Because with MS, the immune system attacks the myelin cells, which are protective sheaths around the brain and the spinal cord nerves. And this damage then interrupts the messages which are sent by nerves to the rest of the body. And this gives rise to the well-known, perhaps not that well-known, symptoms of multiple sclerosis. We're thinking changes in vision, muscle weakness, muscle stiffness, and muscle spasms, numbness or pain, loss of balance, difficulty with cognitive function, and also mood changes. Now, I'm going to stop sharing, and I want to show you this little video from the Mayo Clinic. Now, let's see, does this work? That one, share. Okay, so I'm going to stay quiet now whilst this guy talks to you and tells you about MS.
I'm Dr. Oliver Tobin, a neurologist specializing in multiple sclerosis at Mayo Clinic. In this video, we'll be covering the basics of multiple sclerosis. What is it? Who gets it? The symptoms, diagnosis, and treatment. Whether you're looking for answers about your own health or that of someone you love, we're here to provide you with the best information available. Multiple sclerosis is a disorder in which the body's immune system attacks the protective covering of the nerve cells in the brain, optic nerve, and spinal cord, called the myelin sheath. And this sheath is often compared to the insulation on an electrical wire. When that covering is damaged, it exposes the actual nerve fiber, which can slow or block the signals being transmitted within it. The nerve fibers themselves might also be damaged. The body can repair damage to the myelin sheath, but it's not perfect. The resulting damage leaves lesions or scars, and this is where the name comes from: multiple sclerosis, multiple scars. Now, everyone loses brain cells and spinal cord cells as they get older, but if part of the brain or spinal cord has been damaged by MS, the nerve cells in that area will die off faster than the areas around it that are normal. This happens very slowly, usually over decades, and typically shows up as gradual walking difficulty happening over several years. When you read about multiple sclerosis, you may hear about different types, the most frequent being relapsing remitting multiple sclerosis. And this is characterized by attacks or relapses. We don't know what causes MS, but there are certain factors that may increase the risk or trigger its onset. So while MS can occur at any age, it mostly makes its first appearance in people between the ages of 20 and 40. Low levels of vitamin D and low exposure to sunlight, which enables our body to make vitamin D, are associated with an increased risk of developing MS. And people who have MS who have low vitamin D tend to have more severe disease. So people who are overweight are more likely to develop MS, and people who have MS and are overweight tend to have more severe disease and a faster onset of progression. People who have MS and who smoke tend to have more relapses, worse progressive disease, and worse cognitive symptoms. Women are up to 3 times as likely as men to have relapsing remitting MS. The risk for MS in the general population is about 0.5%. If a parent or sibling has it, your risk is about twice that, or about 1%. Certain infections are also important. A variety of viruses have been linked to MS, including Epstein-Barr virus, which causes mono. Northern and southern latitudes have a higher prevalence, including Canada, the northern US, New Zealand, southeastern Australia, and Europe. White people, especially of Northern European descent, are at the highest risk. People of Asian, African, and Native American ancestry have the lowest risk. A slightly increased risk is seen if a patient already has autoimmune thyroid disease, pernicious anemia, psoriasis, type 1 diabetes, or inflammatory bowel disease.
Okay, so now I have to carry on with the PowerPoint. Okay, so now you can see this guy gives a nice summary, and I will be repeating some of the information that he shared. So, like he mentioned, the 3 types of MS. So the relapsing remitting MS, or RRMS, is what about 85% of people who are diagnosed with MS will be diagnosed with this type of MS. It's the most common way in which MS starts, and what's characteristic of this type of MS is that there are flare-ups of new or old symptoms, and these flare-ups are followed by periods of remission. The next one is the one which from which you progress from RRMS eventually to the secondary progressive MS. And this is because the nerve damage that accumulates, and the symptoms then gradually worsen, and periods of remission are less likely to happen. And then primary progressive MS, here the symptoms start off slowly and then gradually worsen over time, and there are no periods of clear relapse or remission. As he said, there's no cure for, well, we don't know what causes it, and there's also no cure for MS. The medical treatment aims to reduce the symptoms, slow down progression, and shorten the duration of flare-ups, and then basically try and treat specific symptoms. Because Similar to there being no known cure for MS, modern medicine also don't know of any prevention for MS. However, there might be something we can do to avoid MS. I'm answering the question, or minimize the symptoms and the progression. First thing is to avoid excessive intake of alcohol, because we are not supposed to be pickled in alcohol, to avoid neurotoxic drugs and chemicals, and like he said, it will be beneficial to quit smoking, because people who smoke are more likely to develop MS, and they have a more aggressive disease course, and they also tend to have more brain lesions and brain shrinkage than non-smokers. And if somebody's diagnosed with MS and they are a smoker, I would suggest they quit immediately. Then detox regularly, and this is because we know that a healthy gut leads to a healthy immune system, and detoxing is a good way of ensuring that your gut bacteria are healthy and you get rid of the non-good bacteria in your gut. Exercise regularly. This comes with time spent outside, because research shows that people who spend more time in the sun and those with relatively higher levels of vitamin D are less likely to develop MS than those who do not. And also, people who have MS and who spend significant time in the sun and or have high vitamin D levels have less severe course of disease and fewer relapses. Next is avoid stress, because stress worsens the immune response. And there are two ways in which that stress has a direct negative effect on the immune system. First off, it creates chronic inflammatory conditions, because if you're always stressed, your body is going to undergo inflammatory processes, and it also lowers the immunity of those who otherwise might have a healthy immune system. Follow a healthy diet. Next slide will cover that. And last, towards the end, take good quality nutritional supplements, and I'll talk about that as well. So let us look at the role of nutrition in MS. First off, eat a whole food anti-inflammatory diet. Important probiotics like yogurt and kefir, and omega-3 fat, let me just go back. So disruption of the equilibrium in the GI tract has been linked with many autoimmune disorders. Animal and some human studies have shown that probiotic cultures can regulate and modulate the immune response and promote anti-inflammatory responses. So that will help with the immune system. Omega-3 fatty acids, particularly those from fish oil, which are EPA and DHA, are useful in the management of autoimmune diseases. Given that the myelin sheath is made up, 65 to 70% of that is made up of omega fatty acids. This is why omega-3 fatty acids have been investigated in patients with MS. Eat organic fruit and vegetables, because they are antioxidants, specifically the green leafy ones. Now, much of the damage in autoimmune diseases like MS can be linked to free radical damage to cell membranes and tissues. Studies have documented that oxidative stress and low antioxidant activity occur in immune diseases like MS. And they have found that patients with MS have a significantly lower antioxidant capacity when compared to control subjects. Now, even though you might eat organic fruit and vegetables, you might find, if you look at the Environmental Working Group's guidance on the internet, that they may not be sprayed with pesticides, but they might be sprayed with other things to promote shelf life. So I always suggest that you use LDC to wash your fruit and vegetables, and look at with a guided EWG guidance to see which are the most polluted fruit and veg. And then lastly, increase vitamins and minerals, especially vitamin D, because vitamin D helps to keep the immune system functioning properly by inhibiting the proliferation of the T cells, which are the attack cells in the body, and decreasing the production of the pro-inflammatory cytokines. Now, specific things to also add are green tea and turmeric, because green tea has been shown to improve the symptoms and reduce the pathology in some animal models, whilst the curcumin found in turmeric has been shown to have the potential to protect against cardiac inflammation in animals, and by extrapolation, it may have the same anti-inflammatory effect in MS. Avoid refined table salt, because different studies found in a mouse model of MS that a high salt diet actually accelerated the progression of the disease. Then increase glutathione levels. Now, glutathione is the principal component of the antioxidant defense system in living cells and has been demonstrated to have diverse effects on the immune system. It can either stimulate or inhibit the immune response to control inflammation. Foods which are rich in glutathione include asparagus, spinach, zucchini, potatoes, melon, grapefruit, strawberries, and peaches. Some foods also contain compounds which trigger the body's production of glutathione, specifically fresh raw milk and raw eggs. However, these benefits are completely lost due to pasteurization if you don't buy specifically fresh raw milk and you eat your raw eggs. Sulfur-rich vegetables, thinking of garlic, onion, parsley, and cruciferous vegetables, are particularly helpful in addition to avos, squash, and tomatoes. I do note that cooking reduces the glutathione content of vegetables by 30 to 60%. And if it's canned, that glutathione is completely eliminated. So tinned tomatoes and tinned vegetables will not help at all. Whey protein, on the other hand, also contains the highest levels of the full range of naturally occurring glutathione precursors. And those precursors allows the body to then synthesize glutathione by itself. And then finally, I've mentioned turmeric at the top. Turmeric contains curcumin, which may also be helpful in enhancing the glutathione metabolism. But be sure to find a high quality source of turmeric that is organic, properly ground, and additive free. Now, moving on to nutritional supplements. I am a great fan of New Life Nutrition. So the first one is the New Life Shake, because this contains the amino acids which the body needs to synthesize hormones, enzymes, and proteins. And the hormones and enzymes regulate body functions, and the proteins are there to repair the damage. The fats in omega-3 salmon oil plus help to reduce inflammation in the body and also lessen the immune response to allergens and horrible things. Acidophilus, which unfortunately isn't available in South Africa anymore, supports the beneficial bacteria in the GI tract, which are crucial for a healthy immune system. Vitamin D supports the immune function and helps with maintenance of normal muscle function. Good product that we have in South Africa is the Mind Enhancement Complex. It supports brain signaling and enhances blood flow to the brain. The other product, which contains green tea amongst other things, and also a good selection of herbs, is the New Life Tea, which support mental alertness. The antioxidant properties of vitamin E supports brain health and promotes immune function. and also helps to remove the free radicals which cause damage at cellular level. Carotenoid complex provides antioxidants to support the immune cell function and also to help to remove free radicals. And then last but not least, the Pro Vitality Plus, because it contains the three main products which helps the body. So the triene lipids and sterols support healthy cell membranes, as much of the damage in autoimmune diseases like MS can be linked to free radical damage to cell membranes and tissues, and the lipids and sterols help to repair that damage. It contains carotenoid complex to provide the antioxidants to get rid of the free radicals. The omega-3s provide the fatty acids that we heard about a little bit earlier. And then there's the multivitamin, which provides 11 vitamins and 12 minerals, because all these nutrients have work together and they all work synergistically. Now, the last thing I want to say is that the recommended dose on the containers, you should consider, if you take these, you should consider them to be a maintenance dose rather than a therapeutic dose. You may have to take 3 to 4 to 5 times sometimes of these products to make a difference in how you feel and your symptoms are. But these products are made from whole food, organic food sources, so it's unlikely that one can overdose, which unfortunately can't be said of medicines. And there are my references. So if you want to know about, do your own research using my references, you are welcome to do so. Thank you very much.
Hey, fantastic job, like always, Annette. Wow, great information.
Good, thank you.